Hi, my name is Emma Niedermayer, and I'm going to discuss a study titled Risk Factors Associated with Cast Complications in Horses. As we have discussed in class, the horse is a tremendous athlete that can compete in many events like racing, rodeo events like barrel racing, team roping, and jumping, just to name a few. With these events comes more of a likelihood for injuries to joints, muscles, and bones, like tendon and ligament injuries, fractures, lacerations, hyperextensions, bone chips, and many more. Casts are often used to treat injuries like I mentioned in the previous slide, to prevent injured joints and areas from moving so they can heal faster. The two types of casts looked at in this study were traditional and bandage, which I will go into more detail in the next slide. But the purpose of this study was to determine the frequency of complications associated with half-limb and full-limb casts in horses, and to identify risk factors such as complications. Here are pictures of a traditional and bandage cast. The traditional cast, on the left, are like what humans get when they break bones and is made out of polyurethane resin impregnated fiberglass tape strips over a layer of padding. Bandage casts, on the right, are just using bandages wrapped tightly around the leg to prevent it from moving. This compares a full limb and half limb cast. The full limb cast obviously encompasses the entire limb, where the half limb only covers half of the limb. Data was collected from medical records at the University of Missouri, Iowa State, Purdue, and Georgia vet schools. The horses were put into two categories, depending on whether they had a traditional cast or bandage cast. Information collected from the medical records included x-rays, which hospitals the horses were treated at, the age, breed, and sex of the horse, what injury the horse came into the hospital with, the tissue or bone that was injured, the limb which the injury was on, the time from injury to hospital admission, and any surgeries that might have been performed on the injury. In total, 398 horses were evaluated, representing 17 breeds. Of the 398 horses, 152 had forelimb cast, and the remaining 246 had hind limb cast. They found that a cast complication of some kind occurred in 49% of the horses, which is nearly half. They also found differences in complications when comparing the traditional cast to bandage cast. Of the horses that had a traditional cast, 52% had a complication. Of the horses that had a half-limb cast, they saw a complication occurring in 50% of those, with a complication occurring in 60% with a full limb cast. So out of the horses that had a bandage cast, there's a total of a 34% complication rate. And they also saw a 29% complication rate in the half limb, with a 38% rate in the full limb cast. It is important to note the difference in total percent between the traditional and bandage cast, the 52 versus the 34, and that the bandage cast is significantly lower. This is due to more padding being added to the bandage cast, and it wasn't much of a surprise that there was such a significant difference here. Of the cast complications that occurred, cast sores were most common, with making up 45% of the complications. The researchers also found that the most common location for a horse to get these sores was on the palmar or plantar region of the fetlock. They also noticed that how the limb was positioned in the cast had an effect. In the picture, A and C are flexed positions, where B is a neutral position. This means that the positions A and C are more likely to develop complications. The main point of this study is that complications are fairly common with casts, and most commonly, sores tend to be the complication. The most important thing is to try and prevent them, or catch them before they get bad. One way to do this is use thermography to detect signs of heat from inflammation or infections. The most important thing to keep in mind that when injuries occur to our horses, and the vet will decide if a traditional or bandage cast will be used. Our job as owners is to watch our animals closely to help cut down on the numbers of complications to ultimately prevent other injuries and lamenesses from occurring.